It's been about a week since the online health insurance marketplace known as MNsure launched here in the state of Minnesota. Joining me right now to talk about that first week and about what's to come, we have the Executive Director of MNsure, April Todd-Malmlov. Thanks for joining us. We appreciate it.
Thanks for having me.
This is obviously a very busy time for you, so let's get right to it. It's been, as I said, about a week since the launch. If you were to grade the performance of the website launch, what grade would you give it?
I would give it a grade of very good. And the reason I would say that is that we were up on time and all the main functionality that needs to be there is there. And we're very excited to finally be hitting October 1st. It's been a long time coming and it's been a lot of hard work for staff. And we're just very excited to be able to get individuals and families and small businesses some more options for coverage.
And it's been about a week, and there are roughly 6,000 Minnesotans who have created accounts on the website. You've stated that this is higher than anticipated. That's been quoted in several different newspapers. So what kind of experience do you think the majority of those who registered online have had? And essentially, what can Minnesotans expect as this moves forward?
So I think most Minnesotans, when they're on the website now, are probably doing a lot of shopping, and we would encourage them to do a lot of shopping. There's a lot of changes coming for 2014, and so people should understand what their options are, which is why we thought the account creation would be a bit lower to start and would start to increase quite a bit into November and December.
Do you think that there were some bumps in the road? So do you care to address any of those? And then how are you moving forward to navigate through those?
So really the biggest issue that we faced is with something called remote identity proofing. It is a federal service that we use that essentially it's a security function to make sure that people are who they say they are when they're going through and picking a plan and enrolling in that plan. And that service from the federal government during this first week has been intermittent. And I think the reason for that is there's been just so much intense interest at the federal level on this particular, on the health exchange, that it's just been creating a few starting bumps along the road for the rest of us.
There were concerns in virtually every hearing leading up to this launch, particularly by Senator Michelle Benson, that the training wasn't necessarily complete on time. That was her concern, and that perhaps there was some misprioritization from the management as to trying to get that training done as opposed to some other elements. Was training an issue when all was said and done?
Well, training for our staff, we continuously are doing that. I think the training that we would have loved to have done earlier would have been training for navigators and brokers. And really the training there came in during the last month of September before we went live, and that training continues to go on. And really the reason for that is, building a massive system within a year's period of time, and really a lot of the training that we needed to happen right when that system was coming up. And so we did have a lot of training for our navigators and brokers right towards the end, but those individuals are not being able to access the site until they do finish that training.
And you essentially are overseeing this, again, using your words, this massive system. So give me your impression of the insurance products that are available and the work that's been done thus far.
Well, I think the insurance products that are available we are extremely happy about. I think, as you maybe heard before, we have the lowest rates in the country, which is great news for Minnesotans to have that access to really great coverage. I think our carriers have done a really good job in bringing us some really low prices.
The mandatory health insurance portion of this Affordable Care Act doesn't take effect until January. So what's your advice to Minnesotans who might be frustrated at this point with the entire process?
Well, really the requirement to have health insurance coverage, as you mentioned, starts January 1st of 2014. And so individuals have up until the middle of December to really evaluate what their options are and see what coverage is best for them. And for most Minnesotans, so for those on Medicare, for example, or those that have a large employer plan, they're not going to need to do anything. Really what MNsure is there for those people that don't have coverage or that have individual market coverage today, small employers, and for those that might be eligible for our public programs on medical assistance and Minnesota Care.
And yet we are hearing about some large employers who have retired employees, IBM being one of them, who are opting out of providing any kind of health care for those employees. Did you anticipate that when this whole process began?
Well, I think, once you go into 2014, there are a lot of changes in the law, and I think all employers and all individuals are trying to evaluate what that means for them. So I think there will be a few years of transition here where there are some changes that occur.
And therein lies the bigger question. As this thing moves forward and as all of these changes pop up, how do you navigate through those without and try to keep a positive perception of what MNsure is all about?
Well, I think the positive perception comes from the fact that there are so many good things happening. For now, starting in 2014, pre-existing conditions go away. Premiums based on health status go away. People can't be denied coverage anymore. And so really, What's changing is for the better. It's just a lot of change at one time, and it is going to take a few years to implement.
And it is fair to say that change is difficult for a lot of people. Do you think that this is a change that, when all is said and done, will be a positive one, or, as some state lawmakers have argued, this could implode and it could go back to the way things were? You being in charge of MNsure, obviously, I think it's fair to say that you're hoping that all goes well. But as you see things going down the road, how do you anticipate those problems so that MNsure doesn't go away?
Well, I really think what the changes that are coming from the ACR are very positive ones. As I mentioned before, a lot of good things in there for individuals to help make coverage more affordable and more accessible. But as with any other large change, for example, when Medicare went into play, when Medicaid went into play, and Social Security, it's a large change, and it is going to take some time to fully implement itself.
Do you think the customer service portion of MNsure is up to speed concerning all of the questions? Obviously, this is a big endeavor, a lot of questions. Are people getting the answers they need?
We are very pleased with our call center. We went up a month early, and people are getting their questions answered. The wait times are very low, and so our call center is doing an absolutely great job. We're very proud of them.
My last question for you, April. The eyes of the nation are obviously watching. So as you move forward with this, what kind of impression do you think Minnesota is going to make nationwide?
I think the impression we'll make nationwide is that we continue to be a leader on health reform generally, and that we will continue to lead the nation, and we should be very proud of that.
Okay, with those words, April Todd-Malmlov, thanks so much for joining us today. We really appreciate it.
Thank you for having me.